Hey, Dr. Steve Stokes, Advanced Pain Solutions, talking about shoulder pain. We do a lot of shoulders here at the clinic. We treat a lot of people with shoulder problems. First thing you want to know is what's the cause of your shoulder pain. And it can come from a lot of different sources. Even the gallbladder can cause shoulder pain. But what we're going to primarily look at is if it's the soft tissues of the shoulder or if it's the joint. First of all, if you take your arm of your bad shoulder and you bring it up like this, and you can raise it all the way up like this and down, if you can do that and you're having shoulder pain, chances are I can fix that pain for you. If as you bring your arm up to this position here, you end up hiking your arm up like this and you can't get it up any higher, I may be able to fix your shoulder pain as long as the rotator cuff muscles are not completely torn. If they're partially torn, we can repair that without surgery. If you have a complete torn rotator cuff, if one of the rotator cuff muscles is completely torn, and when you raise your arm you get to here, and then you can't bring it up any farther, you need to have shoulder surgery to repair the function. There's no other way around it. However, if you are only partially torn, or if there's imbalances in the muscles, that can be repaired without surgery through our clinic. We do a lot of manual work, a lot of manual therapies to help repair the partially torn muscle and regain your function. If you bring your arm up like this and you can't bring it up any farther than this, you take your other arm and put it here, and then you push down against your arm like that at about 60% of your force, and do that for about 10 seconds. Then rest, and when you rest, bring it up a little more, push down, rest, down, rest, down, rest. If you do that and you can ladder your arm all the way up so at the end it's completely up, and the main reason why you're getting restriction is because of a tight latissimus dorsi muscle. Again, that's just something you can try. That makes it easy to fix. We just have to stretch and lengthen those tight muscles. We use a lot of different techniques to do that in the clinic, different types of post-isometric relaxation techniques. If the cause of your shoulder pain is not soft tissue, meaning it's not ligaments, muscles, if it's articular, if it has to do with the joint itself, with the degeneration of the cartilage of the shoulder joint, then you have to regenerate that cartilage in order to repair the shoulder and get rid of the pain. You have to regenerate shoulder cartilage. And you can regenerate cartilage as long as you supply the cartilage with an increased uptake of blood and oxygen. So for that, we primarily use class 4 30-watt laser. We use Hakumed electrotherapy, some oxygen, and we give the patients very specific movements to do that will not strengthen muscles, but instead pump the fluid in and out of that cartilage space that needs to regenerate. So these are just a couple of ideas on shoulders and how to repair shoulders. The good news is that maybe less than 10% of patients who come to me with long-term chronic shoulder pain, less than 10% are referred out for surgery. So we really have, great results in repairing damaged cartilage and also repairing partially torn rotator cuffs as long as it's not completely torn. So give it some thought. If you have any interest in having me look at your shoulder, just call the office, come by. We work every day, 8 to 5. Do a lot of shoulders. Probably 20% of my whole practice is shoulders. And the treatments are non-invasive. There's no drugs. There's no surgery. And usually patients will see a good improvement within 14 days. Thanks. We'll talk again soon.